I've spoken with many physicians throughout Ontario and throughout Canada. And unlike physicians from around the world, doctors here in Canada are hesitant to speak out. Thankfully, we've had a few doctors such as Dr. Matt Strauss, Dr. Kulvinder Kaur, Dr. Stephen Malthouse. There are some that are speaking out, but very few. And there is no organized group of doctors here in Canada speaking out like we're seeing throughout the Western world. And when I say I've talked to physicians, many of them share my concerns that our government's approach to COVID is unreasonable, it is disproportionate, and that it's causing more harm than good. But around the world, doctors are standing up. They are speaking out. Throughout the Commonwealth, throughout the Western world, many are speaking up. On September 5th, 415 Belgian doctors wrote a letter to their government. And I want to read just a few excerpts from their letter. I'll put this up on my website as well so that you'll be able to share with others so that you can know the facts. Here's what the Belgian doctors said. After the initial panic surrounding COVID-19, the objective facts now show a completely different picture. There is no medical justification for any emergency policy anymore. The current crisis management has become totally disproportionate and causes more damage than it does good. This is written by 415 doctors as well as 1,400 medical professionals just on September 5th. Throughout their document, they go through many elements of COVID and our policies. Like our own medical officer of health, who confirmed that the PCR testings do provide a high level of false positives, the Belgian doctors talked about this as well. And they state, the use of non-specific PCR tests, which produces many false positives, showed an exponential picture. If someone tests positive, this does not mean that the person is actually infected, is ill, or is going to become ill. Why are we testing when we know that there are many false positives and that it is not an indication of infection? We've known this for some time, but in Canada, neither the media nor our own physicians are talking about this. And I've spoken with many of our physicians, and there is a reluctance, there is a hesitation to speak out publicly on this. The singular biggest reason for that is that there is a level of caution and a level of fear that speaking out publicly on COVID may result in an investigation by their regulatory board, and their license to practice could be threatened. That's a big and terrible price to ask people to pay, just to be truthful and honest. But the Belgian doctors obviously don't have that same coercive element at play, or they've overcome it, because they go on to say about the consequences of social isolation on physical and mental health. Fear, persistent stress, loneliness as induced by social distancing has proven to be a negative influence on psychological and general health. And they conclude with, COVID is therefore not a killer virus, but a treatable condition. A treatable condition, not a killer virus. That's a powerful statement, and it's not a statement that we've heard by any public health officials in Canada, not by any political leaders, not by any premiers or our prime minister, not by anybody. The doctors go on as well and speak critically and effectively about the use of facial coverings and masks. And they state, oral masks in healthy individuals are ineffective against the spread of viral infections. That's what the Belgian doctors are saying. But again, it's not just there. We know that there's another over 600 doctors in Germany that have come out with similar views. The doctors in the United Kingdom have also come out, and they wrote a letter to their Prime Minister, Boris Johnson, as well as the Minister of Health and others on September 21st. And they wrote in their letter, this was approximately 100 of the top UK physicians, the existing policy path is inconsistent with the known risk profile of COVID-19 and should be reconsidered. The unstated objective currently appears to be one of suppression of the virus until such a time that a vaccine can be deployed. This objective is unfeasible and is leading to significant harm across all age groups, which likely offsets any benefits. And I read that passage from the UK physicians because that is what most of the Western world is facing right at the moment. An unstated objective. No political leaders are actually telling us what they want to achieve. Unlike back in March, when the pandemic was declared, most Western countries stated we wanted to flatten the curve and not overwhelm our hospital systems. Well, we've achieved that. We achieved it in spades, and we achieved it many months ago. But we don't know what the objective is today. The UK physicians are seeing through the chaff, seeing through the fog of COVID, and recognizing what is happening without being stated, but are also putting out that this objective is not feasible and is likely to cause more significant harm. That was a letter written to Prime Minister Boris Johnson on September 21st. Again in September, a significant group of Australian physicians got together and wrote a letter to their government. And I'm just going to read two quick passages from their letter, because much of it is also been covered by the Belgians and been covered by other well-documented considerations. But the Australian physicians state, in short, the medical, psychological, and social costs of the lockdown are disproportionately enormous compared to the limited good being done by these policies, and are relevant factors to be taken into account by a responsible government. That's a powerful statement because it's showing our governments have not been acting responsibly. In their recommendations, and they have 5 different recommendations, and I won't go through them all, but I'll post these documents on my website and on my pages so that you can see and read them for yourself. And I'll highlight the passages so you can see that these are indeed facts, and share them with your friends and families and people who may not be hearing the whole story. But here's the first paragraph in the recommendations. For all these reasons, ordinary, sensible people, if properly informed, should inevitably conclude that the current government policy is ill-focused, heavy-handed, and unjustifiable as a proportionate response to the risks posed by COVID-19. Australian doctors, German doctors, Belgian doctors, UK doctors, American doctors, they're all speaking out, but here in Canada, except for a handful, we hear silence. But I want to come back to the Belgian doctors' document, just because I think it really speaks to another important element of this. It's the oath of office. I spoke about this, my oath of office. All physicians have an oath as well, the Hippocratic Oath. And let me just read it in brief. I will above all care for my patients, promote their health, and alleviate their suffering. I will inform my patients correctly. Even under pressure, I will not use any medical knowledge for practices that are against humanity. And then they conclude with this statement: the current measures force us to act against our oath. Isn't that incredible when government policies are forcing physicians to act against their oath? We all need to speak up, whether you're a physician or whether you're an electrician, whether you're a blue collar or a white collar. The consequences of our policies are harmful for us, but significantly and gravely harmful for our children and our grandchildren. Let's be like the Belgian doctors. Let's be like the Australian doctors. Let's be like the Germans and the UK doctors. Let's all stand up, speak out, share the message, and bring a reasonable and proportionate response and policies in to deal with COVID.